Lori. Hi, everyone. My name is Lee Cohen, and myself and my colleague, Dr. Gardner-Meyer, are in charge of the cognitive fitness program here. There's Dr. Liz on your camera. We are in charge of the cognitive fitness program here at NUCASLL. And let's start with some of our disclosures. So I am a speech language pathologist with a specialty in adult neurological rehabilitation, practicing for over 11 years now. And my colleague, Dr. Gardner-Meyer, practices at our clinic as well with a specialty in tinnitus. And we are both very passionate about optimizing brain health and thinking how critically it is our roles as communication sciences that we both work with how individuals listen, interact, connect, that optimize brain health. So this is where we are going to cover lifestyle modifications that drive neuroplasticity. Okay, so our learning objectives for today is to understand neuroplasticity, identify the key parts of cognition. We want to examine cognitive lifestyle changes. The reason for that is there's a lot of research, a lot of therapeutics that are being looked at right now. But what we're finding to optimize brain health are lifestyle changes. And that's why we find it so important to educate our community of what changes we can make to improve brain health. At the end of the lecture, we'll also review some key takeaways, and we're interested in learning what you found to be the most important factors introduced today. Okay, so we want to start with what neuroplasticity is. When we think about neuroplasticity, it can be both positive and negative, and it's really the ability to make lifestyle modifications that can drive your brain to learn from experience. And so we have this slide right here, but in the chat, I would be curious because I know the word neuroplasticity has been a big buzzword. So I'm curious from our audience what you find to be your own understanding of neuroplasticity. What is your definition? I just want to see some of the input from the audience here. Let me go back here. And Dr. Liz, are you seeing anything in the chat just yet?
Not yet.
Okay. Okay. So if we're all being shy to start, that's absolutely fine. That's why we're here. So neuroplasticity, it's the brain's ability to adapt and change in response to experience. This could be both internal and external, positive and negative. What we want to talk about today with lifestyle modifications are positive lifestyle modifications that drive neuroplasticity. As an expert in this area, I find that there's a misunderstanding of when, oh, we do have a question in a response in the chat, but there's a misunderstanding of critical time periods for learning. And what we're finding about neuroplasticity is the brain has, throughout the continuum of your life, the ability to adapt and change and learn. And so let's see what the chat brings up. Flexible thinking, absolutely. Have seen the term related to AI. Chat was just enabled. Thank you. Brain and other neurological flexibility, absolutely. And so when we think about some of this flexibility, we want to talk about what positive variables we can introduce that really encourage neuroplasticity, that drive neuroplasticity in the brain and are able to provide greater synaptic connectivity. And so when we think about that, I really like this visual here of what happens to our receptors, the way the body receives messages and sends messages. And I like this image of what happens before learning and then how our brain responds and connects more effectively after learning. So really what I want you to take from this image is that leading a healthy lifestyle can strengthen your neural connections in the brain, through several mechanisms that promote neuroplasticity. Okay. And what we're thinking with that is it's the brain's ability to reorganize, form new connections, and lifestyle greatly contributes to that to really support this robust neural network. It enhances cognitive function, memory, and overall brain health throughout your entire lifespan. Let me see. I have another comment in the chat. Thank you so much. Ability to learn new things and understand new ideas. Exactly. That's really what we are emphasizing here with neuroplasticity. And this is why, as a speech-language pathologist who practices in adult neurological rehabilitation, this is why we intervene. This is why we provide services here at our clinic in order to optimize brain health at any stage of life. Okay, so let's talk about ways to enrich neuroplasticity. Lifelong learning, and obviously you all are big proponents of that, being a part of OLLI. Social connections, which are imperative, right? Being connected to others, learning about others, sharing. It allows you to think flexibly. Maybe your friend, your family member has a different opinion than yours, different perspective taking. So social connections are so significant for challenging our cognitive flexibility. And, and our patients. Mental challenges. So being able to think of different new games, new music, new instruments. I know my mom is a big proponent of the New York Times crossword puzzle, and she said she always does the Sunday one. Stimulating environments, thinking about what you are bringing into your home, how you are immersing yourself in the outdoors. A little bit harder in Chicago when it's negative 19 degrees out, but we try. Dr. Gardner-Meyer is from Minnesota originally, so negative 19 does not bother her in the way that it bothers myself, who's from New Jersey, but used to somewhat warmer weather. And then
Lee, I was
yes,
going to say,
Dr.
someone in the
Gardner-Meyer.
said one of my favorite lines, you just have to dress for the cold. There's no such thing as bad weather, only bad clothing.
Exactly.
Negative 19 is still cold for me, though.
Oh, okay. Well, good to know. Today is too cold for, I would say, the majority of us. Some questions that are coming up in the chat. The role of social connections. Yeah, just have to dress for the cold. Susan, are you from Minnesota? There's a high probability that you are. And again, before we move on to the next slide, any other variables that we might not have discussed that you find to be enriching that drive learning in your life? This is a good list, but not exhaustive. So we're eager to hear from the OLLI community. What do you find to be enriching for your brain health outside of this list? Let's see. Learning a new skill. Absolutely. There's a lot of research, Tom, coming out about learning new skill and related to learning a new language, learning a new instrument, learning a new game. Absolutely, Mary. Art, Robert, puzzles, yoga. Yeah, that yoga we think of as a moving meditation. Learning pickleball. Yeah, that's very popular. Plants in our talk series at NUCASLL that we're giving for the winter series, we go a lot into plants when we discuss the environment. So thank you for that, Dora. Learning new software, yeah, getting into technology in a safe way, right? Not the overdose of it, face-to-face connection, helping others, right? Our altruistic pursuits, playing card games. This is a very sharp group. Lots of wonderful, wonderful suggestions. So I also, in addition to myself and Dr. Gardner-Meyer, I have a wonderful group of graduate student clinicians that are also going to be guiding you through this lecture today with extensive research that they have conducted. So I'm first going to introduce Annie Magner, followed by Jennifer Perez. So I'm going to take it to Annie right now, where she is going to be talking about what can be negative when we're thinking about how to drive neuroplasticity. Before I move on to her, let me just look very quickly in the chat. Cooking, playing the piano or an instrument, all great examples of neuroplasticity. Dr. Liz, I couldn't have said it better myself. So now we're going to move on to Annie Magner, and she is going to discuss how neuroplasticity can be negatively affected. Here's Annie.
Hello. So, in the same way that you can organize your life to promote your positive neuroplasticity, you also can organize your lifestyle to maybe hinder those neural connections. And so, a non stimulating lifestyle deteriorates neural connections, which can cause brain shrinkage and a buildup of harmful plaques and proteins in your brain. And so, what might this look like? We say sticking to automaticity and the mundane. That doesn't challenge your brain as much as learning all of these new skills that you guys have shared does, which is why we do encourage you guys to try something new and stay social, which is great. So, don't want to focus too much on the negatives. So, now we're going to talk about how we can promote positive neuroplasticity. And these are the lifestyle modifications that myself and Jennifer are going to talk to you about. So first, we are going to do a neuroplasticity activity. Here I will show you an example of an activity that I administer to some of my clients. So I will tell you the color, not the word, of these following words. I'll show you. Blue, green, red. Now, I want you to try this on your own. Read left to right, top to bottom. Go ahead. And then when you're finished, feel free to let me know how this felt in the chat. I want you to pay attention to how that felt for you, the challenge of saying the color.
This was hard, right?
Mm-hmm.
It takes a lot of focus. Awkward.
Awkward, for sure.
Yeah.
For sure. It is a great exercise. Yep. For sure. Yeah. Oh, my apologies, Randy. So I'll explain the task. Oh, mismatch, concentration. Yep, definitely. Gear switching. Yes. Mm-hmm.
It gets easier with practice. So what she was having us do was to, instead of reading the color, so the first word is purple, we were to think red. So we were to consider not what the word says, but the color of the text. If you are colorblind, this is going to be very difficult to do. For the rest of us, it's a mind teaser on how to adjust your thinking for a specific task.
Mm-hmm. And so we call this the Stroop test. It is simple, reliable, and well-researched, and it's often used to measure our patient's inhibition, being your ability to suppress impulsive responses that interfere with accomplishing a goal. So with this, it pulls on your selective attention because you're really focused on attending to the goal of saying the color of the text, as Dr. Liz was saying, while ignoring the distraction of the written word. So it requires strong executive functioning skills, as I mentioned, inhibition, but also your flexibility and self-monitoring. You're probably reminding yourself constantly of the rules because you really have to inhibit that automatic response. So one of the studies confirming the reliability of this test looked at brain scans of Alzheimer's patients while performing this task over time. So once initially and then a few months later. And they found that as their Alzheimer's symptoms worsened and became more severe, the brain activities that help with your cognitive flexibility, that help with this task in particular, decreases. So it becomes a lot harder to perform tasks like this that require your flexibility. Thank you guys for sharing. Okay. And so now we are going to learn a little bit about diet modifications from Jennifer.
Okay. So our diet that's most recommended and very popular with physicians is the Mediterranean diet. And I would love to hear from the chat what they think this diet consists of from this picture. What types of foods do you think the Mediterranean diet includes?
Minimally processed fish, nuts, veggies, fish and vegetables, fish, vegetables, olive oil, foods that are whole in nature, non-fat proteins. Yes, because these are true foods. They're whole foods rather than a processed version of a food. Lean meats, nuts, seeds, healthy fats, low carbohydrates. Absolutely. Very good. So this is an image of what we're supposed to eat, right? Often we get told by our doctors or other, resources on these are things that we should eat and they're good for brain health. And what we would like to do in this is, from a clinician's perspective, why is that?
Exactly. So as a lot of you were saying, the Mediterranean diet's like a high intake of fruits, vegetables, fish, olive oil, and it's been linked to show improvements in executive functioning and overall cognitive performance, as well as memory for clients with mild cognitive impairments. And research has shown that adherence to this Mediterranean diet was associated with better episodic memory, which is our ability to learn, store, and retrieve information about personal experiences. Working memory, which is our short-term memory that stores information temporarily, and overall global cognition. So, a balanced intake of carbohydrates, fats, proteins is essential for optimizing brain health and your cognitive health as well. So now we're going to talk about exercise, which is our next lifestyle modification.
All right. Sorry for the musical chairs here. But now we're going to talk about how exercise relates to your brain health. So, exercise might help lower the amount of buildup of those plaques we were talking about earlier in your brain, as well as increase and strengthen the blood vessels in your brain, which is very important for your cognitive functioning. A study looking at a group of dementia patients measured cognitive functioning before and after 9 weeks of exercise. So there were 3 different groups. One completed both aerobic exercise and resistance training. A second group did just aerobic exercise, so they went on a daily walk. And a third group didn't do any exercise. After 9 weeks, they measured cognitive functioning and found improvements in memory, executive functioning, and attention. Their findings suggested that aerobics and resistance training provides the most benefits for individuals, leading to improvements in all of these cognitive functions. These findings highlight the importance of a holistic exercise approach, so not just doing one or the other, but combining both aerobic exercise and resistance training to enhance not only your motor abilities, but also the cognitive abilities. And so with that research, we went onto the CDC's website to look at their recommendations for how much exercise you should participate in weekly. And so here you'll see the recommendations on the slide. The CDC recommended at least 150 minutes of moderate intensity physical activity a week, such as 30 minutes a day, 5 days a week. And that could be simply just a walk outside, which also would be good for you mindfully, And then as well as adding in resistance training. So some sort of strength training at least 2 days a week would support your cognitive functioning. And once again, I want to highlight the importance of a holistic exercise approach. So not just focusing on one of these two types of exercise, but combining these together, as well as with mindfulness, which is what Jennifer will go into now.
Okay, so before we go into mindfulness, I wanted to ask our audience, when we refer to executive functions, we have some examples here, reasoning, planning, and problem solving. But when we talk about executive functions, we talk about higher level cognitive skills. What else could executive functions include? I think we're still sharing the slides.
At this point, I see the aerobic and resistance training. I don't see the slide for the executive functioning.
Oh, don't worry, because we're just talking about it.
Got it.
Yeah. So I'm curious.
Andy had said organization and planning.
Love it. Deductive reasoning, absolutely. Organizing, ordering, setting priorities, creating lists, creativity, absolutely. So we're starting to see that diet and exercise optimizes these very important skill sets that let us complete what we term here in our therapeutic care activities of daily living. When you think of your day-to-day activities, what do you need executive functions for? I don't think I can do a grocery shop without executive functions. I need to plan it, I need to organize it. So let's get some examples going there of, you're not just exercising in order to look healthy. It's also from the inside out. And so when we think about executive functions, how might that help you? Paying bills, handling finances? Yes, absolutely. What else require these higher cognitive thinking skills that you need for day to day? Math class? Absolutely. Preparing meals, class assignments, prioritization. Yeah, that's definitely an executive function skill. Yeah, being tech savvy on your phone, programming and organizing. Right, absolutely. And when we think about, and so the combination here, my question too is what Annie just presented, right? 150 minutes of moderate intensity, such as 30 minutes a day, 5 days a week, in addition to 2 days of weight training, or something where you have to have uh, and then incorporation with that, it's not only those two things recommended, but what Jennifer's going to present is the inclusion of also mindfulness, and that actually gives you the most bang for your buck, right? And so who knew this to be the recommendations? Because I think a lot of times, myself included, we go to our providers and it's just eat healthy and exercise. But how many of you knew it in this granular way of what constituted the Mediterranean diet or what the CDC actually recommends? Oh, good question. What is mindfulness? That's a great question. Jennifer, that's coming to you. We're going to cover that. That awareness, getting directions, driving, walking, public transportation. Yeah, especially on a day like today, you don't want to not have the right directions and be taking public transportation, right? Okay, so wonderful. We appreciate all of your interaction here in the chat. And I think it's a great segue now to move to mindfulness, because, right, it's not just the aerobic exercise and the resistance training. When we think about what's going to optimize brain function, it's also the inclusion of mindfulness. And so we thought it would be so important to take you through a mindfulness exercise. Does anyone here have practiced any form of mindfulness? And that can be in the form of walking, a moving meditation, any apps that we might suggest? I use one. I'll add it into the chat. I use, and this, I'm not paid by them at all. I just use it for my own personal time. I use Insight Timer for sleep at night. Does anyone use any mindfulness apps? I use 10% Happier, meditate daily.
Right.
I do mindfulness exercises. So for those of you that do practice mindfulness, before we introduce it today, any positive features that you would like to share about a meditative practice? Yep, Daniel Siegel. Oh, these are great suggestions. How does mindfulness contribute to your life and your brain health for those that practice? I'm curious before we introduce it. We will be sharing research on that as well. More relaxed and focused. Yeah, absolutely. Lower stress. Yeah, thank you, Frida. Absolutely. Mindfulness when eating, right? Being really intentional about what you're eating.
Another
Greater
form,
appreciation, some a gratitude meditation, more self-compassion. Anything to add, Dr. Liz?
yeah, I was going to add prayer is another form of mindfulness that was added to the chat. There's
Oh,
another
great.
way that they can answer and ask questions on my
Lovely.
end. And one that I had is when I practice mindfulness, I find that I make better decisions. I'm more thoughtful about the decisions that I make.
Absolutely. Absolutely. Kinder, gentler towards others, right? Helps your
Absolutely.
connections and your interactions with others, right? We care about that deeply as speech language pathologists, audiologists, but also humans. Lovely. Okay. Stay in the moment. Would you consider going to therapy as a form of mindfulness? I think going through a meditative practice here, thinking how it makes you feel, I think maybe adapting one into your own life. And we believe in presenting the research and then allowing you to make informed decisions about if it's a practice that would be appropriate for you. Science beyond the benefits, expressing gratitude.
There's a question about would you consider going to therapy as a form of mindfulness? Perhaps. I would say that some therapists will use different therapy techniques and strategies based on the specific area. So there's one specific type of therapy called cognitive behavioral therapy that might use mindfulness practices. I have been trained in something called motivational interviewing, where we might practice mindfulness and looking at goal setting. So it depends on the therapy, but I would imagine that there's a good chance that there's some form of mindfulness in that therapy.
Yeah, absolutely. And so let's have Jennifer take you through mindfulness practice right now and share some research with you. Okay.
So some people were asking in the chat what research backs mindfulness with cognition. And there was a research article that showed following 8 weeks of mindfulness training, a group of healthy older adults demonstrated improved cognitive functioning compared to the control group. They also showed greater connectivity within parts of the brain that are more susceptible to the effects of aging. 1 week of this mindfulness training program focused on the 5 physical senses, which I'm going to walk you through right now. So I want you to sit up nice and tall, feet touching the ground, and we're going to go through all of these senses. So I first want you to notice 5 things that you can see in your surroundings. Notice the shape, notice the size, the color, and pay attention to how that makes you feel. And take a deep breath in, deep breath out. And now I want you to notice 4 things that you can feel. Pay attention to the softness or the hardness of that object, if it's smooth or bumpy. And then take in another deep breath in and a deep breath out. Now I want you to notice 3 things that you can hear. It can be my voice, I'm hearing the air conditioning. Pay attention to how that makes you feel. Take in a deep breath in, deep breath out. And I want you to notice 2 things that you can smell. Notice like how potent that odor could be or how faint it is. And take in one more deep breath in, deep breath out. And notice one thing that you can taste. And as we close that exercise, you need to open up your eyes. I would love to hear from the chat how that exercise made them feel. If there was one sense they were more aware of than other senses, or if there was one that took more focus, or it was harder to pay attention to that one. I would love to get some thoughts in the chat. Sight, that was one of the ones that was strong for me too.
The smell was hard for me. Taste was hard for me as I only had water available. Tom, I felt the same way. When you mentioned taste, I thought about getting a sip of my tea. Smell took over. Banana bread in the oven. Oh, I love that, Marcia. The dog continuously barking. So sometimes there's sounds that we don't care to hear. And then when we have mindfulness practices, we are more focused on those things. These are great. Smell and taste to a brownie. That sounds good right now. Notice your tinnitus. Uh-oh. Yeah, that happens when you have tinnitus. Silence is not golden. How do you deal if you're losing hearing? Well, as far as the mindfulness exercise here, if you are losing your hearing and perhaps it's not treated or you don't have your hearing treatment in, you might be focused on other sounds. Maybe you hear the sound of the radiator kicking in, or maybe you are hearing a different sound, or perhaps you don't hear any sounds, and that's the hard one for you.
Yeah, Lori also brought up a great point, saying that the sounds were there all along, but I only noticed them when I was prompted to think about them. And I think it just shows you mindfulness for me helps me be present in the moment and focus on my like one sense. So it just shows you how like that selective attention like is linked with mindfulness too.
Very good. These are great. Easiest to notice and see, not a lot of sound. So that vision kicked in as one of the most commonly commented here.
Okay, great. So this is just a simple mindfulness exercise that you can implement into your daily life. It could take about like 5 minutes. Just remember the 5, 4, 3, 2, 1 with the different senses. Okay, so now we're gonna move on to our next lifestyle, which is sleep. And so for sleep, it's important to get an adequate amount of sleep every night because there's key functions that occur during sleep. So for our cognitive health, such as energy conservation, self-repair and recovery, and memory storage. Sleep is important to your cognition because it clears out amyloid plaque, which is linked to cognitive impairment seen as Alzheimer's. Everybody accumulates these plaques. However, people with Alzheimer's get them at a much faster rate. At night when we sleep, these plaques are cleared out in our brain. And research emphasizes that positive lifestyle changes, like we've been talking about, like such as diet, exercise, sleep, stress reduction, and managing conditions like diabetes and hypertension, can improve overall brain health and potentially reduce the risk of Alzheimer's, even for those who know they have accumulating plaques but are not yet symptomatic. And Annie's going to talk about a research study that further talks about this.
Thank you, Jennifer. Okay, so a research study that we looked into asked the question, is it harder to find words when you're sleep deprived? So they investigated essentially how a night of sleep deprivation affects people's performance on tasks of verbal communication. I will make a little note that while this study might seem a bit dated from 1988, it is the foundational research study that current researchers are still using to cite and support their findings. So, this study looked at two groups. One was assigned to stay awake all night at a lab, and another had a normal night of sleep at home. In the morning, both groups returned to the lab and were given a verbal fluency task. They were asked to name as many verbs as they can associated with a specific noun. For example, if they were given the word pen, they might have responded with write, hold, click, sign, tap, and so on. They found that the sleep-deprived individuals overall generated fewer words, and their responses consisted of less unique words and more errors. So they might have repeated themselves or said just more of a generic verb that wouldn't tie directly to that noun. So these results are supported by other findings more recently, saying that sleep loss interferes with innovative or novel responses. So your innovation is somewhat impaired. And that with sleep deprivation, your behavior becomes more impulsive and automatic. So as I was saying earlier, the mundane and automaticity of your life actually is that negative neuroplasticity. So learning something new and sleeping is supporting that positive neuroplasticity. Okay, and so now I want us to do an activity that mimics what was done in that study. So I know it was kind of a lot to explain, but I want you on your own to name as many words as you can that start with the letter M, as you'll see here, M. However, there are a few rules I want you to be mindful of. Do not name any words that begin with a capital M, like a name such as Mary. Also, do not name the same word again with a different ending. Like if I said mop and then mopping and mopped, that would not necessarily count. So to keep track of your number personally, you can either write these down on your own or just count on your fingers in your head. I will give you 1 minute. So when you are ready, go ahead and start. Great. So our minute is up. You can finish your list. And I am wondering how many people got. Did anyone get maybe more than 10? Ooh, 16. Awesome, Mary. 11, 13. Oh, wow. This is impressive.
23. Wow.
23. Oh my gosh.
19, 13. Wow.
Wow.
These are some smart people.
Wow. You guys, this is awesome. So typically in this task, we look to get around 10, a little more than 10. And so I'm seeing a lot of you getting above 10, which is really awesome to see, actually. Oh my gosh, awesome. And so, did anyone notice themselves using any sort of strategy or thinking in a certain way? How did that make you feel?
Um, as people are typing, I found myself thinking about cooking. So mince and, okay, from A to a second letter, vowels,
I
pairs of
like
each vowel, clusters of words. Some
going
of
through
these
categories. Yeah.
remind me of Wordle, that game. I
Yes,
wonder if we have some
exactly.
Wordle players here.
Yeah, when I did this, I found myself looking around the room, just trying to find anything I can see. Yep, Eileen agreed. That's so good. Thank you guys for sharing that. So this task placed demands on your word retrieval, which is our verbal communication, and your mental flexibility. So you're thinking flexibly about different words while also making sure to inhibit impulsive responses that might be names, because I, for myself, found myself thinking of names and then reminding myself of the rules. And so that also calls on self-monitoring, which is another executive functioning skill. Great. Yes, some words can help you think of another word, for sure, for sure. But yeah, so this task was used to measure people's verbal fluency in relation to their sleep. And so if you maybe got a poor night's sleep last night, maybe you didn't do so well on this test, but this is something that maybe you can do for yourself to kind of measure how you're feeling and your creativity. All right, and now I'm going to turn it over to Jennifer to talk more about sleep.
Okay, so here are some ways that you can improve your sleep. So keeping your bedroom cool and dark, having a consistent bedtime, avoiding caffeine drinks like coffee in the afternoon and evening, eating a small snack if you're hungry, and also turning off work and electronics at least 1 hour before bed. And I would love to hear in the chat what other suggestions you have for your nighttime routine to help with sleep. One way I support my sleep is usually like an hour before bed, I'll avoid electronics and I'll just read a book for like a half hour. Light yoga, deep breathing, like mindfulness, there you go. Eye masks to keep it nice and dark, and earplugs. Listening to gentle music. Love that. Sound machine. It's good too. These are all great suggestions. Okay, and now we're going to go into our last lifestyle modification.
And real quick, before we do that, Dr. Liz, don't you have a suggestion for if you like to listen to music at night to help you get to bed, but maybe your significant other doesn't? Isn't there a device that you can recommend as an audiologist that I can listen to music, but maybe my partner doesn't have to
Mhm.
help get to bed?
Yeah, so that's it's a common question. Ideally, we'd have something that both of the people sleeping will like. And that's because the reason why I say that is it's good for our sleeping habits to have some sort of auditory stimulation. And so having nature sounds or something that both parties like can be good. But if only one person wants to listen to a specific thing, there are products like headphones that you can wear that might be flat, so that you can have your head against the pillow. There are products that we can recommend that can be an insert within a pillow. So you have to have your ear right up next to it. There are a lot of products out there if the other partner doesn't want to listen to whatever that person wants to listen to.
Something that also came up in the chat is that the problem is waking up more than once and having trouble getting back to sleep. And we discussed this more in depth in our cognitive series at NUCASLL. But something that I am personally working on that has helped me with my sleep, and we had discussed during our cognitive series in the fall, is being careful when you wake up at night not to look at your phone. Because technology use during sleep can affect your circadian rhythm. Now, something that my colleague and friend, Dr. Liz, suggested to me is that to listen to perhaps a podcast that's not too interesting, right? That could help me get to sleep rather than scrolling on my phone. And that has been something that has been really helpful in addition to listening to meditations to get me back to sleep. But Frida, we get into that into a lot of depth within our cognitive series, but that is a very common problem of waking up at night and then having a difficult time getting back to bed. Anything to add to that, Dr. Liz? Read a few pages, then close my eyes and see how much I remember the story. That's a great
Yeah.
suggestion too.
I think that what I would suggest is looking at the sleep hygiene checklist and seeing, are you doing these things? And
Yeah.
then I'm not a sleep expert, but in researching for our sleep session, we learned a lot about habit formation and routines and so forth. And having a positive outlook on rest. So even if you don't fall asleep and get into a REM sleep cycle, are you still breathing in a calm manner? Are you perhaps meditating or having more of a blank slate in mindfulness, rather than having your mind working hard, thinking about all the to-do lists, things like that. So even if you don't fall back asleep right away, are you still in a resting state?
Yeah, absolutely. Absolutely. Okay. And we have a lot of great suggestions here in the chat. I would encourage everyone to look at the wonderful suggestions by our community here. And then, NUCASLL. So that's our university clinic on our Evanston campus here. And I'll put in it's at 2315 campus.
And we call it NUCASLL because it stands for the Northwestern University Center for Audiology, Speech Language Learning. So it's a building, it's our clinic. So Lee Cohen and I both see patients here at the clinic. It's on site.
Oh, thank you,
Thanks,
Vidya.
Vidya.
So now we'll get to the last lifestyle modification that we are going to discuss for this presentation, which is hearing. And Dr. Gardner-Meyer is going to educate us here. Okay.
So how we hear is related to many other areas of our life. And so I put this page up, and we might know that hearing loss is related to depression. But it might not be as immediately obvious that it is related to falling. And so what I wanted to have you think about is, why is hearing important? You might have heard at some point that there's a relationship between hearing loss and dementia. This program that we're talking about and the skills that we're touching on today is to help you come up with modifiable adjustments in your own life for a matter of preventative health. So when we think about mindfulness and communication and all of these pieces, we cannot separate those from hearing entirely. Sometimes we have other health conditions, for example, diabetes, that might increase our risk for hearing loss. We are in an area of preventative health with this program, and we wanted to make sure that hearing was a factor in this lifestyle modification. So if you've not had a hearing test or a opportunity to screen your hearing, I'd encourage you to do so. There are many ways that that can be done. One at home, simple way that you can do it that's reasonably effective as a pass-fail is if you use the Apple AirPods and the hearing screening program that's built into Apple AirPods. The clinic also does hearing screenings and many other places in the community, or primary care physicians' offices will have hearing screenings. And we've referenced the program that we have. You have the flyer and so forth, but in our full session where we spend a week on each one of these, I talk about hearing and how communication with hearing can improve your overall cognitive health. And your enjoyment of life, because it's hard, you know, we're encouraging you to be social, but it's hard to be social if you have a real challenge hearing in the presence of noise. Many of these things are related, and I can help with what we can do to bridge the gap when there is a hearing problem.
Something else, Liz, that you had mentioned to me as just a colleague that I find to be a fascinating fact is by the time someone has a sense that they might have hearing difficulty, and the amount of time between knowing you have a hearing difficulty to actually getting intervention is an average of 11 years. Is that correct?
It's somewhere between 7 and 11 years. There's one gender that tends to be on the closer to the 11 side versus the 7 side, but it's a long time that often lapses between when someone starts to recognize that they are having a challenge hearing and then when they actually act. And in that time period, they can be missing out on life. And that's what we don't want. I love working with patients that come in and are interested in a baseline hearing test or know that they have a very mild hearing loss and are ready to do something about it. Because we're in the business of helping people live their fullest lives. And it's very hard to do that when there's a hearing impairment.
Mm-hmm. And where we think about this as a team of speech language pathologists and audiologists is the more of a struggle that our clients have to hear, the less energy they have to use their cognitive skills, right? Because they're working so hard on hearing the conversation that it might be harder for them to, grab onto the information, retain it, and then store it into their memory. And so we think about this as a multidisciplinary team often of where are the obstacles? Is it hearing? Is it memory? Is hearing challenging and then it's demonstrating as a memory deficit? We think about these situations often with our clients to provide the most effective holistic care. And so that starts with what we're doing here today, which is education. And so when we think about the course takeaways, we're going to go over some of the highlights, but we'd like to know what are some of the takeaways that you are pulling from this in-service today? What are some of the things that stuck out to you? It's important for us as providers to know what messaging is being effectively communicated. So when it comes to these topics, what were some effective takeaways? Okay, the importance of exercise, absolutely. Not just for our physical health, but for our cognitive health, right? Yeah. What else? Mindfulness and the important role of that, right? The most bang for your buck, right? Cardiovascular fitness, resistance training, and mindfulness, the best for your cognitive health. Yeah. And so let's go through some of these that we hope can help. All that you mentioned is important. Thank you very much. So with neuroplasticity, we think about cognitive enrichment, and that's what you all are seeking out, being a part of this wonderful organization called OLLI, right? You're embracing learning and cognitive challenges to make your brain adaptable, malleable, being able to continue to learn and build new brain connectivity, right? hmm And then the diet, right? Focusing on the Mediterranean diet. It's not just so we feel good, it reduces neuroinflammation, it boosts brain function, right? We're feeding to not only optimize our physical health, but also our cognitive health. Even the principles of neuroplasticity and how a diet contributes to it. And then we also think about exercise, right? That cognitive agility. It also reduces neuroinflammation. It allows our body to be mobile, our brain to be malleable, gets rich oxygenated blood to our brain. Sleep, how it helps us to consolidate memory, supports emotional regulation. I'm not the first to say that if I have a rough night of sleep, that it can affect how balanced I am the next day, and how focused I am. And then hearing, it's important to stay on top of one's hearing, protecting it, being aware of what treatment may be necessary, right? And maybe reducing that 7 to 11-year gap, right? Let's see what other comments came up. And so there's diets that, there have been new drugs recommended, and there's extensive research being involved with these therapeutics. But with our extensive research that we have done, the biggest proponent of optimizing brain health are lifestyle modifications, because so much of what we are hearing is just in the research phase with these drugs and needs a lot more research and time in order to support any kind of findings across a big population of individuals, right? So I would caution anybody looking at research that's anecdotal or there's a small sample size. We really looked at extensive research with large sample sizes, so it wasn't just by chance that someone improved, with this lifestyle modifications, but a very diverse sample of people and a lot of individuals being able to express that there was positive plasticity from these lifestyle modifications. So I encourage all of you to do your research and look at really how many people are being looked at in the study and the effectiveness and the diversity of individuals that they're looking at. But again, really being advocates for your health and, in conversations with your medical providers, if they're making these recommendations, asking for resources. And again, that's something our cognitive fitness program provides, is extensive research behind these lifestyle modifications and resources.
And one of the participants had said small and manageable changes can pay off with a big difference. And I think
Yeah.
that's well put of exactly what we're hoping for. There was another question about supplements, and in our full program, we like to bring in experts within specific fields. So my expertise is in hearing, and Lee is in speech language pathology. And so in our program, we will invite someone like a nutritionist to come in and weigh in with those types of specific questions.
All right. So the nice thing about our program is we are having the expert consultants coming in, and we take our information about the beauty of omega-3s and polyphenols and different antioxidants, and we have our expert consultant go into that in a more with more depth and in a more granular fashion. Yes, Ronald, this will be recorded by OLLI. And again, I'm going to put the information here in the chat. We have our cognitive fitness series starting at NUCASLL. It actually starts Wednesday, January 22nd, but we are always happy to do individual and group sessions. If you're not able to come to any of the remote sessions, it takes place 6 to 7 p.m. And it's virtual. And if you want more information about it, please don't hesitate to contact NUCASLL at northwestern.edu. We can talk to you further about the program and get you enrolled for this talk series. Again, we are at time at 1 o'clock. We appreciate your participation with us today. We appreciate this opportunity from OLLI to have such great outreach with so many members of our community and really thinking about the health and humanity and connection of all of us. And we thank you for your time. Again, if you want more information about our program or to be connected to us, please contact NUCASLL at northwestern.edu. And we look forward to a continued partnership with OLLI. Thank you again for your time.